So RFA stands for radiofrequency ablation, and that is just a technique that is used to destroy tissue, right? It can be used in many different ways. The way that we use it for treating venous insufficiency is we have a small catheter. It's about the size of a piece of spaghetti, and we'll insert that catheter right around the knee. And the idea is if this is the knee here, we numb a spot around the knee. We insert the catheter going up towards the groin, and then once that's in place in that refluxing or the main superficial vein, we'll do a few injections along the course of the vein. And what we're doing there is just we're numbing up the tissues around the vein. We're squeezing the vein shut, so we're kind of squeezing all the blood out of that vein. And we're anesthetizing the tissues, but we're also insulating the tissues around that vein. So whenever that catheter is in place, after those first couple minutes where we put that numbing medicine in, then the catheter is inside the vein, but the vein is collapsed around the catheter, and the vein is kind of floating in this fluid. So then when we turn on the catheter, that catheter heats up. The tip of the catheter has kind of a carbon or a copper coil on the end, and that coil heats up, and what it does is it seals the vein wall shut. So as we slowly withdraw the catheter out of the leg, it seals the vein behind it. The reason we like RFA versus a lot of people hear about laser and it sounds like it's space age and new. It's actually older technology. The issue with the laser is the laser just has one wavelength that comes out and it just shoots out the laser fibers or the laser light and out of the fiber, and the only way to determine how much energy delivered to the tissues is how quickly you pull the laser back. And so it's much more likely to cause kind of hot spots or cause areas that is closed more in others than others. It has a higher risk of just postoperative pain, bruising, because it literally cauterizes the vein. The RFA, the idea is we're just trying to heat it to seal it shut, so you get less pain, less bruising, less downtime, but they're both equally effective, so that's why we use it in our practice.